thank you all for joining me this evening. So I'm glad you're all here. So hopefully you'll learn some good information to take back with you to your health systems when you leave today. So I did want to start a little bit about just explaining, like within Advocate, what our structure looks like within the digital team. So we do fall under public affairs and marketing, and also within the digital structure, we have two separate disciplines. We have the digital marketing function and focus, and then we also have the consumer experience piece. And then that functions as one broad team, and we all really work together on everything. So within my realm is digital marketing, it's content, it's design, and also social media. So in total, there's about 13 of us on the digital team that make up everything that we do from a digital advertising perspective, and we almost think of ourselves as a mini digital agency within Advocate, and everything that we do is pretty much done in-house. So we do work with other agency partners to look at developing creative, but when we do digital creative, it's really all done and produced, and all the content, all the websites, all the landing pages, everything done within our own digital team. So a little bit about what I'll talk about today is just to give you the landscape of Advocate Healthcare. I'm going to focus on our Advocate clinics at Walgreens and the plan and how we launched and implemented that, especially in the digital space. And then the Advocate clinics digital marketing plan, so how are we actually driving the traffic then into our locations. And then we're going to switch up and talk a little bit about launching a heart CT scan retail like digital marketing plan. And then what were the outcomes and successes of these campaigns, and then what's next for us on our roadmap. So Advocate Healthcare, we're local in Illinois. We're the largest health system here in Illinois. Over 450 sites of care, 12 hospitals, 35,000 employees, and when you look at our landscape in digital, we have over 8 million visits to our website last year, and 66% of those are coming from a mobile device. So we're seeing tremendous growth year over year with people that are coming to the website from mobile, from tablets. So everything that we do from a digital perspective is really focused on that mobile first mentality. And one of the things that we look at, and we're really focused on is this big digital transformation and everything that we're doing in this space. So in order to do this, we really had to follow a roadmap for everything that we launch, whether it's different products, different website strategies, digital marketing initiatives. So let me ask this, do you all within your organization have digital strategies, set digital plans? Who has a digital strategy? So that's great, and it's really set us to have this foundation to be able to move forward on everything that we do. So when you look at our digital strategy, it really is to become the #1 health system in the nation by redefining the way that we deliver healthcare to our consumer, whether it's from a mobile health standpoint or any of these other areas. So we're really focused, again, on that consumer experience, and that's why we've developed that specific team within digital to really focus on looking at that day over day and what that looks like and how that helps us grow. Health. So we've actually formed a digital steering committee made up of operations folks, physicians, clinicians, marketing executives, all at the table to be able to come together to launch this strategy. Because if you don't have all of these separate partners working together throughout the organization, then you're not really going to be able to launch the breadth and depth of all the digital things that you need to do to be able to move forward, especially in the health space and having the buy-in from the physicians as well. CRM, definitely something that we're looking at in terms of growth and to help move a lot of our marketing initiatives. Digital marketing, focusing on that, working with Google. So we have a partnership with the Google Health team, and we meet with them on a monthly basis, and they really help us form a lot of our digital marketing strategies and how we implement them successfully, and how we tie it all back to the broader data that we're collecting on all of our patients, and then in turn being able to use our CRM so that we can see really what the ROI is and being able to measure that throughout the organization. In social media, we have a really large focus on social media. We have an in-house social team. We do all of our own social advertising, all of our creative, and we're really focused on using social for the cost per lead, so we're able to really drive and look at how many conversions we're driving from a social perspective. So just some digital wins that we've had this year. So we've launched ratings and reviews for all of our physician profiles. We've launched a live chat on our website. We have now we have over 600 doctors with online scheduling. So that's made up of our Advocate medical groups, our own physicians, that's primary care, residents. We've just launched cardiology, and we've also just launched online scheduling for mammograms. Number 1 in social media followers in our market, schedule with a resident, cardiology appointments, and then we're continuing to use our CRM and looking at different results from heart scans and different Medicom assessments that we do throughout, and then we use the website to promote them along with digital marketing. So when you look at our audience and you think it's only the millennials that are online, it's really not. And this is actually family members of one of our executives that they snapped a picture of them, because it really is our best performing campaign online is our touting our Medicare Advantage program. So when you look at social media and the people that are responding and looking, we're really seeing a shift in the audience, and it's really the baby boomers as well that are online. So when we have that mobile first mentality and we're developing this digital strategy, we're not just focused on millennials. This really is a mobile strategy that spans across generations. So a little bit more about the Advocate Clinic at Walgreens. So we have been open with the clinics for a little over a year now. And when we first launched back a year and a half ago, we had about 2 months notice to get everything up and aligned operationally. So this wasn't something that was planned for a whole year and a half in advance that this was coming, especially from a marketing perspective. So it was 2 months before launch. We're owning and acquiring all of these 56 Walgreens locations throughout the Chicagoland area. How are we going to market them? How are we going to get them up there? And we got 2 months to do it because we're opening in May. And it was okay, how are we going to do this? Let's get going. Let's figure it out. So there was a lot of different things to consider in terms of launching. Our first dip into retail in the healthcare space. So. What is our service model like? And, when we look at all of these locations, it was really about access and being able to provide that top quality care really in your own neighborhood, in your own backyard, because there's a Walgreens on every corner. So, where are those clinics at, and how are we going to have that message out there that this is easily accessible in your own backyard? So we staff them with board-certified nurse practitioners in each one of these locations. And what do we treat? Minor injuries, aches, pains, physicals, skin conditions, point-of-care testing, and then scheduling. It's either online or walk-in care. What were some of the challenges that we knew we were going to face right off the bat with this? And one, it was really price transparency. And price transparency from the perspective of now we have a retail-like setting with all of our locations in Walgreens, but we also have immediate care locations in our owned medical group locations and in our hospital locations, with all three having different price models. So how do we accommodate that from a retail perspective when you know that you can go to the CVS Minute Clinic and they're touting, $99 physicals, and then we have a different price model for each one of these locations. So it was really about operationally, how are we going to pull all that together? How are we going to have a single price model that then we can communicate from a retail and marketing perspective to really drive that traffic in? So, and then how are we going to communicate that on the web, right? Because there's different cost models for different things, there's different services offered, but we didn't want to market separately immediate care at our hospitals versus Walgreens because it's all walk-in, it's all book online, it's all immediate, and we wanted it to, that experience, again, that goes back to that customer experience line with our digital strategy, we wanted it to be seamless. So creating a landing page that would do that. Owning and dominating local SEO. Well, we know a lot of these locations, Walgreens, they're going to come up first and foremost in a lot of these search engine results. So how are we going to shift that paradigm so that it's not Walgreens that it's showing up, it's all the Advocate clinics that Walgreens showing up. So definitely looking at how are we going to improve those experiences and how are we going to improve that mobile experience, because Walgreens already had a set app that you can go on and you can schedule online. You can book online immediately, and the process and the customer experience was actually really done really well. So now we're no longer going to be using Walgreens scheduling model. It has to be Advocate scheduling model. So we had to build a whole new experience around how is someone going to book online, how are they going to book online and integrate with our hospital, or not our hospital, but with our Advocate medical group scheduling system, so that all these appointments are seamless and going right in through to our database within these locations within Walgreens. So that was another challenge. How are we going to implement that and operationalize that? So we started to roll out internal communications, and that's really where we started. So when you look at that, was developing toolkits for all of our various hospital sites, because now we have 12 different hospitals, and all of these hospitals have different Walgreens locations in their market. So it was media alerts, event invites, FAQs, letters for all of the political officials in all of the different markets. And how are we going to tout this in terms of our own associates, right? We have over 35,000 associates, and there are, #1 brand ambassadors. There are customers. So we want to make sure that now we're going to integrate and offer them benefits and discounts to be able to use these locations throughout their insurance benefits. So working with our benefits and HR to do that. Opening day celebrations, which we'll get into. Leadership and physician memos, getting that out to make sure that everyone across the organization was aware of this, associate e-blasts, newsletters, digital signage throughout all of our internal locations for all of our associates, and then, of course, intranet, and how are we going to communicate that out on the web. So external marketing, we had opening day events at select locations throughout the Chicagoland area. We had press releases that, again, went out announcing the grand opening events and all the benefits of these clinics. Direct mail, website banners, we had the landing page development, we had tear-offs in all of our Advocate Medical Group offices, and then we ran some pretty comprehensive digital marketing campaigns. We needed to create new branding, right? Because we didn't want different organizations or different areas using different branding. Everything needed to be consistent. So it was really working with our agency to develop these really tight-knit brand guidelines that we would follow, whether it was in terms of co-branding with Walgreens and our offices, our digital assets, the circulars, the signage in stores, promotional items that would mirror all the seasonality campaigns that we were to launch, and then everything from a media perspective of what they were going to use all had to be succinct. So how we rolled this out was we had grand opening spectaculars that we called them at 11 different locations throughout the Chicagoland area, with the actual flagship location being right down the block here over at State and Lake. So we created all this buzz in the community on social. We had giveaways and raffles. We had step challenges when you walked into the store location. We had physician champions. We had our APNs, local political officials, Walgreens managers. And the one thing that I want to talk a little bit about is what we used to actually promote this event was mobile wallet. So has anyone done or ran like a mobile wallet campaign or anything? So so mobile wallet, basically a good example is like Southwest. You walk in, you have your airline ticket, you can download it in your phone's mobile wallet, you walk into the airport, and now they're serving you up push notifications, here's your airline ticket. So we did something very similar. So we wanted this event to be very exclusive, very, that you can come, download your VIP event ticket onto your phone. You come into any one of those Walgreens locations during that event, and you're going to get a VIP entry, you're going to get a VIP swag bag, you're going to get entered into all these raffles. Now, once you have that mobile wallet in your phone, you can continually communicate and push notifications out to all of these folks whenever they're within a 100-foot proximity of any Walgreens location. So any one of our 56 Walgreens locations, someone comes in, they're getting push notification from us. So what we did to promote this was, download that ticket, get your offer. So we were, promoting the offer via email, social media. We were using Google display ads. We had developed a landing page. So if you weren't on a mobile device or you didn't access this on a mobile device, you can come to the landing page, put in your cell phone number, and we would text you that mobile wallet coupon that you would just download and bring into the store. Again, we did digital campaigns that led up to that, and the tactical plan was the landing page, the SMS texting, the push notification strategy, which consists of, whether you need a flu shot, it's time to get a physical, or if there's, other things seasonality-wise or trending-wise that you're near Walgreens, we had a whole plan set up so that we can continue to target you over the coming months. Website banners, Google display ads, social media advertising, primarily only on Facebook. We have our own healthy news website that we have a daily, it's a subscription-based website. We have a daily news feed that goes out to over 250,000 subscribers right now, and we have ad space that runs in that as well. And then we did some email campaigns, and we did it on a pretty conservative budget, and we had really great success with all of the Walgreens events. So you brought in your mobile ticket on your phone to any one of the locations. We were raffling off Cubs tickets, Fitbits, and all these things that people came in for. So it was really successful. Another mobile offer that we ran along with Walgreens was we were sponsors of the Chicago Marathon. So within the route, all along the downtown Chicago area, we strategically placed VIP areas where cheering sections were all along the Walgreens locations. And to get access to those VIP cheering sections, you needed to download our mobile wallet incentive, and then you would be able to, get access to these exclusive spots. And doing that, again, we captured all of this data and all of these folks downloading the mobile wallet. Now we have just more people that we're continuing to push out our message to when they're near any one of our 56 Walgreens locations. So now that we're open, some of the other things tactically that we needed to do to support this effort was in-store kiosks. So when you walk in, we didn't want you to walk in and get a clipboard and have to come in and fill out all this information and turn it in, because the APN is going to be in the back room and they're going to be servicing the customer. So we had to develop these in-store digital kiosks where you'd walk in and you'd enter in all of your information, and it would give you your approximate wait time, and you'd sit down and you'd wait for your turn. So this is what the landing page looks like that we developed. So now that we have this in place, how are people finding us? How are they getting here? And when they come here, what's the easiest way for them to find our location? So if you add up not only Walgreens, but the immediate cares in our hospitals, the Advocate Medical Group locations, we have over 100 immediate care locations throughout the Chicagoland area. So when you come to this landing page, first and foremost, and a lot of the traffic, almost 50% of the traffic that comes here is coming from a mobile device. We need to make sure that you can find the nearest location to you. So as we develop a lot of our landing pages and our strategies, it's all about that near me moment. What's nearby, what's close, how can I access it? And it's all about that finder, that zip code finder. So you come here, you enter your location where you're at, you begin your search, and then it starts to take you through the process to be able to get you to the closest location and then allow you to book online immediately. So as you go through like the anatomy of our landing page, it's really focused on that search, find your location. Then as you would scroll down, it tells you about what symptoms are offered, the cost for treatment. So we were able to land on I believe $89 for any visit. That's a standard, sick visit, physical injury, so that we are able to promote that from a retail perspective for one set cost and one set price throughout. And then the other thing we wanted to communicate on this page was when should you use our services at an immediate care versus using an ED, because one of the things that we don't want is to send traffic to our EDs. We actually want to keep the patients out of our EDs and into our immediate care locations. So once you go through this process and you put in your zip and you get your search results, especially on a mobile device, we want you to be able to book that appointment. The other thing that we implemented is wait times. So you can go through as you're scrolling nearest to you and see, okay, well I know, the one that's closest to me has a 25-minute wait time, but I'm gonna go down and now I know that, this one, well, it's only a 10-minute wait time. I'm not even gonna bother with making an appointment. I'm in the car, I'm on my phone, I'm just gonna go there. I'm not, so basically we wanna get you in the easiest way with the less amount. Again, goes back to that customer experience, right? So book an appointment. If you choose to go the book an appointment route, you get a page which is a location details page. This for us is almost comparable to a Google My Business page, but within our own website. So this does a couple of things, right? It gets you here with very clear instructions on how to book that appointment. But if you did a search from Google, these pages rank very well from an SEO perspective. So if I'm looking for Walgreens clinic in Park Ridge, what I want to see happen and what the best case scenario is we own and dominate the whole top results of that search engine page. We're gonna own that whole right knowledge graph. We're gonna own the map pack. We're gonna show up with all of our locations. We're gonna have organic listings that are all gonna drive here to this page that's all about the location of where you're at. So again, wait times gives you your appointment information. When you see also on this page the services treated, that's also from an SEO perspective done really well, because now we have all these keywords that are on this location-based page as well. So the likelihood that you'll show up in a Google search is even higher. So just basically taking you through that process. Now we're at the check-in screen and book online. So we do use a third-party vendor that powers our book online technology, and it is InQuicker. So once you start to book online, you now are on InQuicker's hosting service, and you go through that form in their database, and then that is what gets fed into our not our hospital, but our medical group scheduling system, IDX scheduling system. So we kicked off online scheduling in 2 months. So, when I'm not joking when I say we had 2 months to launch online scheduling, and we did, and with a really good partner. So we were able to kick it off on time. We have daily time slots between 11 and 4. Time slots are scheduled every 30 minutes, and all treatment times need to be scheduled at least 60 minutes in advance. And we open up our time slots 24 hours in advance. And we only have one patient check-in per time slot. So each time slot only serves up for one patient. And this is something that's evolved, and we continually monitor, but the process has worked out really good. And again, this not only powers our immediate care for Walgreens, it's our hospital, it's our medical group, it's our mammography, it's the cardiologist, it's our PCPs. Everything is powered through the same system. So what were some of the digital marketing tactics? Now that we have everything set up, we're established with Walgreens, we've got our landing page, we've got our online booking. How are we going to start to really drive traffic into these locations? And first and foremost, we wanted to run search engine marketing campaigns. So we do this today. We were doing this beforehand. We wanted to really expand that effort. So we had everything that we had existing on Google. We extended it to Bing. We know there's 2 separate audiences searching on Google versus Bing, so we wanted to make sure that we were in both places. So we did an audit of our existing campaign. We updated the ad copy because we want to make sure it's specific to book online. We added, again, those click-to-call extensions. We want to make sure that you're able to get where you need to go. And in terms of clicking to call, they're going to our call center because there is really no one way to route all of those phone calls through the Walgreens clinics, because there's one APN staffing those clinics, and they're servicing the patient, right? So they can't be taking phone calls in between. So all those calls are routed to our call center. Then click-to-call extensions, again, that was the mobile, and we do track that via mobile. Updating the geography targeting to make sure that our ads are succinct with each one of the locations in their areas, and then making sure we're tying in those location extensions, right, that are tying into those Google My Business listings. Remarketing anyone that comes to any one of our websites, whether it's our children's website, our medical group, we want to make sure that they're leaving and then seeing our ads. And then RLSA is keyword search retargeting, so it's basically the same thing, except you're not seeing a visual ad, you're going to the website, you're going back to Google, and you're performing another search, and then we want to make sure we're capturing that as well. Display campaigns that were really local focused around all of our different immediate care locations. In social media, when we do advertising on social, it really is primarily Facebook, a little bit on Instagram and Twitter, but it's really focused on everything we do on Facebook. So in terms of the Google search engine marketing campaigns, and anyone that was in Jason's last session, he really went into detail in explaining what PPC is and search engine marketing. So at least I hope that was a good one-on-one if you weren't familiar with what SEM is, and if you were in that session. So we look at branded terms. So we want to make sure, again, that we own and dominate that top space in the search engine results, whether it's with an ad, whether it's organic. So we want to make sure that we're covering all of our own branding. And then also, looking at everyone else's locations, because people are looking for Target Immediate Care, Walgreens Immediate Care, CVS Minute Clinic. So we want to make sure that we're targeting all of our competitors' brands as well. Immediate care, so that's looking at different ad groups for different keywords based on urgent care, express care, walk-in care, any other variations of that. We wanted to make sure that we were covering the grounds on that as well. One of the areas that we found that we didn't have a lot of competition, and it was really kind of us cornering the market on this in the Chicago metro area, was focusing on symptoms. A lot of people don't bid on these symptoms-based keywords because, one, they don't have a great destination to drive them to. WebMD and all these other Everyday Health, they all own this site organically. So when someone's looking for strep throat, you're going to search. Well, you're going to get WebMD. So it's like, well, why? I'm not going to compete with a WebMD. But for us, we want to be in that space, especially because there's not a lot of competition. So our cost per click for these keywords are actually relatively low, and we see a really big click-through rate on this. So what we did was we actually talked with a lot of the primary care physicians at our locations to say what are like those top things, what are those top like 20 elements that people need to be seen same day for, and got this whole laundry list and then built out campaigns around those. And again, this is all a lot of what we're doing in-house and working with Google directly on as well. And seasonal campaigns. So we've just started to roll out seasonal campaigns. So we've developed this whole calendar for, you know, the year long. So whether it's cold and flu, which is going to be in the market this week, it's, you know, allergies, and when are we doing that? School, sports physicals, and all of those things where we want to drive the traffic into our locations, really touting, again, that $89 fee for all of our services. Just an example of some of our Google display ads. So living rooms, not waiting rooms, and book online today. And we have multiple versions of different creative that we have out there that we test with. So some of our ads for seasonal campaigns, and again, we run this creative on Facebook, we run it through Google, and all of the advertising that we do is primarily done through Google and Google's platforms. Again, this was really important for us to own all of your Google My Business listings. So just a takeaway, whether it's a Walgreens, you know, a clinic, a department within your hospital, this is key real estate for you to own that's free. You're not paying for, and you're going to own and dominate this whole right knowledge graph space for all of your locations. We own all of our locations for all 6,500 physicians that we have on staff. We can now measure the phone calls that are coming in to all of our physicians' offices. We had as of end of September, we had over 900,000 calls into our physicians that we're able to track and measure. So very important to own this space, own this real estate. This is your Google Map Pack. This is what's going to come up with your searches organically. Again, there's that location details page. Here's our knowledge graph. One of the things working with our partner who powers our location finder, they were able to work with Google and actually have a direct link from our Google My Business listings. It says appointments. You click, you get to that online scheduling right away to book an appointment. You bypass everything else. You come here, you click, you're going to book an appointment directly from your Google My Business listing. Online chat was something that we implemented back in June of this year, I want to say. We haven't been live for very long. It's been very successful for us. We overlay this on our website, over our Find a Doc, our homepage, but we also do it over our immediate care landing page. And you've seen it very, very clearly from a mobile device. So we're seeing that patients are coming here. We're proactively asking them if they need help, and they do. And we have reps just within our call center that are manning this, and they're literally, in terms of taking one phone call, they're able to do 10 chats at once. So they're finding out where these patients are and being able to give them that direct link to that location page so that they can go on and directly schedule that appointment without having to go through the location finder and have, you know, so we're saving them a lot of steps, a lot of clicks to be able to get here. In some cases, they're calling in the call center. We can text them, you know, a link directly to these pages. So there's a lot of different things that we're doing and that we're facilitating through this online chat. It is powered by artificial intelligence. So as people come in and they're typing in the same or similar things, the tool itself is getting smarter and actually being able to put in a lot of these responses as well, along with our folks at the call center. Website personalization. So we just launched a new content management system on our website. And within that content management system, it allows for personalization. So we took a stab at this on our current medical group website, and we have 3 different content areas that we're able to plug in different content based on algorithms that we set on the back end. So if you come to our website and it's 8 o'clock at night and we know all of our primary care offices are closed, but you're going to need to get in right away, we can serve you up an immediate care message. So we're, you know, if we know that you're coming from a mobile device and you come to our website, we can give you, you know, different information. We can give you to download our portal app versus searching through the website. So this is something that's new for us that we've started to implement, and we are actually going to start to take this to the next level, but it is all about what we're able to define on the back end that powers this experience. So just some quick data on the personalization. These are the 3 different messages that we've had in that area as we've gone through, and you'll see that the immediate care actually is outweighing all of them when we're doing A, B, and C testing in that personalization space. Some quick data for you on online scheduling. So this is Walgreens only. This is not our other immediate care locations, but to date, we had over 100,000 online bookings already into our immediate care locations. Our demographics, it's primarily female. You can see the age range. It really is that millennial audience. Cancellation rate actually isn't that bad. It's pretty low, and patient satisfaction is high. Would recommend. And one of the things that we're actually looking at right now using our CRM is how do we put a value around these patients, right? What is one patient worth to us and coming into the organization through this way? The other thing we're looking at is we know that 38% of people that are coming into these locations are saying that they don't have a primary care physician. So for us, it's a huge opportunity to be able to market it to them a little bit more because we know now we want them to become a patient after they've had this one touch point with us. 49% are new to the facility, and we know that, again, coming to the landing page, it's over 40% of the traffic is mobile. So enough about Walgreens. Another campaign that we're doing and that's in the market actually right now is heart scans. So this we think is really another step into the retail space for us, and it's all about marketing that cost, that one set dollar amount that we could push out to say, come in and do this, it's $49. We're going to scan. We're going to do a heart CT scan, and what the heart CT scan does is it checks all of your arteries that go into your heart for blockages, basically. And this was primarily driven by marketing to do $49 heart scans, and it actually started with $99 heart scans, and then I think we were at $79 heart scans, and it was like, no, we're doing $49 heart scans. And when we went to operations and business development, and it's like, well, we want to do $49 heart. It was like, what? Wait a minute. You're crazy. Like $49 heart scans. We can't do that. Well, when you look at the return that we've been having from offering $49 heart scans to people that are coming in and having these cardiac procedures done, it's far outweighing the benefit for us to do that because we're seeing a huge return on ROI on this. So we wanted to start with a pilot. Let's do this at one of our hospitals. Let's see how well it goes. And, with running these campaigns, when you have one person come in and have a procedure done, it, far outweigh, we've just seen such success for it. So we started with a pilot program at one hospital and then a few hospitals. And then I was like, okay, well, it's January, February. We're going to launch our system-wide cardiovascular campaign. Let's make this part of our larger system-wide marketing campaign. This is going to be rolled out system-wide. So that's what we did. Again, we had to closely work with the operations team because if we're driving in all this volume that they can't handle, that's going to be a dissatisfier, and we didn't want to do that, right? So we definitely had to work with operations, streamline this through our call center, through central scheduling at all the hospital sites, making sure that there were slots available and everyone was ready to take these calls, and online requests. Again, getting the hospitals on board, offering that competitive pricing, and then how were we going to promote this? And we've promoted this almost primarily through digital. So we developed a heart scan landing page. This was for the system. Again, this is a landing page that's meant to, you come here. The consumer makes a decision in a tenth of a second if they're going to stay on this page or if they're going to leave. The only focus we wanted on this page was the call to action, request an appointment. We want you to come in. We want you to request an appointment. You can call or you can fill out the form. The online form, it all goes and gets routed to our call center. Just an example of some of the ads that we ran. Heart scans, not heart attacks, $49 heart scans, $49 can save your life, and the URL that goes directly to our landing page. This is a video. I'm not even going to try to play it because I just know it won't work. But we developed 30-second video clips of actual real patients. We've had a patient that this gentleman came in, had a widowmaker artery block, and literally went right into open heart surgery, and it saved his life. So we've had survive those. No. Yeah. So we've had multiple stories like this. So we were able to create a lot of 30-second vignettes for video that then we've promoted on social, and we also do a lot of YouTube advertising as well. So just, this is some viral and some messages that were shared on social. Got this done in February, $49 test, discovered an aneurysm, leaky valve on my heart, surgery in July, best money spent, saved my husband's life at 60 years old. So, I mean, these are the things that we're monitoring and seeing on social media as a result of this campaign, and you know, we're marketing this as much as we can. So just some quick results for the CT scan. We've had over 5,000 scans since the beginning of the year. Over 3,000 referrals for scans. So, you know, just something that we're continuing to look at in the grand scheme of what we do for cardiology. So, you know, what's next for Advocate? What's in the pipeline, and what are we doing? Again, chat. We've had over 4,500 chats, inquiries about doctors, 20% about immediate care, and 52% resulted in physician referrals. So we're continuing to use and promote chat. We want more agents on chat. We want, you know, chat going, you know, 24/7, and really promoting a lot of our immediate care locations with chat. So that's one of our focuses. Automated outreach, so texting, making sure that anyone that schedules an appointment, a booking online appointment, we're texting them follow-up confirmations, we're texting them reminders. We're also going to be working on a smart text, so that if we do text you and you need to cancel your appointment, you can cancel via text and even reschedule via text. So that's in the works as well. When I talked about doing a little bit more about website personalization, we're actually launching a redesign of our Advocate Medical Group website, so it's advocatedocs.com. And this is our first step in a broader redesign of our entire advocatehealth.com website. We're starting with our medical group, and in doing this, we've developed a wireframe that allows us to have multiple spots on our website for personalization. So having those personalized messages, again, all around, you know, the specifications that we define on the back end, whether it's mobile, time of day, geographic location. If you're searching in the Park Ridge area and you come to our website, we want to make sure that the Walgreens location that shows up on our homepage is the one that's closest to you. So developing our website with this framework in mind is how we're moving forward to make sure we're having that personalized content. Google Smart Display Ads, so this was in beta and just rolled out through Google recently, and right now we use a tool that allows us to create multiple ad sets that we use and upload through Google to launch our campaigns. It's one set of creative, and it's done in multiple different sizes. What the Google Smart Bidding allows you to do, and the Smart Display Ads, is we could take 10 different creative assets with multiple different headlines, multiple different calls to action, and descriptions, upload this into Google's tool now, and based on Google's algorithms, it spits out all of these different ads that are now displayed across the web. So based on the conversions that are coming through on all of your ads, based on the clicks and the costs per lead, Google then uses their AI to figure out what are the best running ads, and will start to serve those ads more and basically wean out all of the underperforming ads. So this is something that we're actually piloting with the cold and flu campaign for Walgreens coming up, and we're just dipping our toes into this now, but it definitely in the long run can save us time and or money with using other tools to actually create all those different ad sets. Just an example of some of the different variations of the smart ads. The other thing we're looking at doing is the email customer list. So that's really looking at taking email addresses that we're getting from our Walgreens patients and then matching those with Google email addresses and being able to serve them up custom ads. So for example, we know 38% of all of those patients that are coming into Walgreens, those folks don't have a doctor. So let's take all of their email addresses, match them with Google, and now we're going to start serving them up ads for finding a doctor near them. So just one of the ways that we're creating these custom audiences within Google, and then also doing the same thing on Facebook.
Do you ask them if they have a primary care physician? Mm-hmm. And that's how you know? Okay.
Yes. So, you know, for you, really, how do you define your retail roadmap? It's not like a one-size-fits-all. It's, again, if you don't have a digital strategy, have that digital strategy, because that's our roadmap for everything we do, whether it's a new website, a product launch, a new onboarding, new locations. Everything that we do goes back to that digital strategy and that customer experience. Plan your mobile moments. Make sure that everything you do, and I know you hear this all the time, make sure you're there from a mobile perspective. But again, those Google My Business listings is what's going to show up first and foremost in a Google search result. So I think that's a good place to start. Work with operations, because if you don't have capacity or bandwidth to do these things, you can't do all these digital marketing tactics to really drive in, that audience and the traffic into those locations and landing pages. Focus on your website presence, again, for search, and making sure that you're representing and looking at all of those opportunities for personalization, and then start your implementing and advertising of all of your programs and locations and any retail efforts that you might have underway. On that note, I will stop and take any questions if anyone has any. Anyone? Yes?
Do you market your heart scan to everyone, or do you have parameters? Because I thought there was parameters for, because we did the heart scan that we were always real careful to market just to over 50-year-olds, and they had to have certain
Yeah, we do. I mean, we definitely look at different, demographics like age range. I'm sorry?
Do you let anyone make an appointment for heart scan?
There's questions, I believe, that they ask when they call in. So they'll call in, and there's certain criteria, like, are you a smoker? Are you over this age? Do you have XYZ? So there are. So it's not, you can't just be like 25 and call in and we'll make the appointment.
Okay.
There is some criteria that you'd have to like fall into that bucket. Yeah. All right. Well, thank you all very much for your time.
Excellent.
And